Good morning to all. The topic of this is dental amalgam and its technical consideration. First, it is amalgam. It is a special type of alloy that contains mercury as one of its constituents. Application as a permanent filling material for class 1 and class 2 cavities in combination with the retentive pins to restore the crown for making dies in retrograde root canal fillings and as a material. Its constituents contains silver, tin, copper, zinc, platinum, palladium and iridium. Majorly silver, it is major element in the reaction. It whitens the alloy, decrease the creep, increase the strength, increase the expansion on setting, increase tarnish resistance in resulting in amalgam. Tin, it controls reaction between silver and mercury. It reduces strength and hardness, reduces resistance to tarnish and corrosion. Copper, it increases the hardness and strength, and it increases the setting expansion. Then come in zinc act as a scavenger or deoxidizer. It causes delayed expansion. Platinum hardens the alloys and increases resistance to corrosion. And mainly iridium, when added, reduces mercury vapor and improves wetting. Palladium hardens and whitens. Its classification includes based on copper content, low copper alloys, high copper alloys. Based on zinc content, zinc containing more than 0.1%, zinc free less than 0.1%. Based on shape of alloy particle, lathe cut, spherical alloys, spheroidal alloys. Based on number of alloyed metals, binary, ternary and quaternary. Based on zinc of the alloy, micro cut and macro cut. Composition, which includes low and high copper. In the comparison between spherical and lathe cut alloys, particles are spherical, it is irregular in shape and it requires less mercury, hence has improved properties, and more mercury, hence required has inferior properties. The main properties is the space between the alloys and tooth permits the micro leakage of electrolyte, and classic concentration cell possess results. The common corrosion of products found with the traditional amalgam alloys are oxides and chlorides on. Dimensional stability. According to ADA specification number 1, amalgam can neither contract nor expand more than 20 μm between 5 minutes to 24 hours. Severe contraction can lead to micro leakage and to secondary carries. Excessive expansion can produce pressure on pulp and post-operative sensitivity. Master contamination during manipulation causes delayed expansion due to reaction between the water and zinc present in the amalgam alloy. This expansion starts after 3 to 5 days, reaching values greater than 400 μm. Strength includes effect of titration. Under titration or over titration decreases strength for both low and high copper amalgam as it affects the reaction between the matrix phase and alloy particles. Effect of mercury content. Sufficient mercury should be mixed with alloy to wet each particles of the alloy, and increases in the mercury content above approximately 54 to 55% markedly reduce the strength. Low mercury content may result in rough pitted surfaces and may lead to corrosion. Effect of condensation. Lathe cut, greater the condensation pressure, higher the compressor strength. Spherical alloy, condensation with a light pressure produces adequate creep rate has been found to be decreases with correlated with the marginal breakdown of traditional low copper amalgam. Higher the creep rate, the greater the degree of marginal deterioration. Here show the creep rate mechanisms and time: onset of mixing, onset of working, placement of condensation, carving, burnishing, polishing after 4 hours. Cavity design, it provides retention, 4 wall support, prevention tensile strength, surface angle. Selection of materials. Alloy should be sufficiently mercury. Main request of mercury is purity. Lack of purity affects physical properties. Mercury alloy ratio. In 1957, new technique of minimal mercury technique or Evans technique is recognized of dentists who developed the concept. According to Evans technique, mercury should be 50% by weight of to 1 ratio. Titration, it is defined as a process of grinding powder within the liquid. In dentistry, it is a process of mixing amalgam, alloy particles and particles with mercury in amalgamometer. Objective titration is achieved either by hand mixing or mechanical mixing. By hand mix, and this is the mechanical mixing. A mulling continuation of titration and mulling dry piece of rubber dam or glove. Rubber dam rubbed with the first finger or thumb 2 to 5 seconds. Mechanical milling mix is re-titrated in a pistol free capsule for additional of 2 to 3 seconds. Advantages: coherent and homogeneous mix. Under titrated mix, it is rough and grainy in nature. Maybe crumbled mix hardens too rapidly, whereas normal mix shiny and smooth surface. Over titrated mix soapy mix under decreased working time. This is the differences. Condensation aim to adapt to cavity wall, remove excess mercury and reduce the voice. Condensation pressure, it should be 2 to 5 kg, 5 to 10 IBS for condensed amalgam. Burnishing pre-curve removes excess mercury, improves margin adaptation. Post-curve improves the smoothness. Pre-carving burnishing objective will reduce the size and number of voids on critical surface and marginal areas of amalgam. It bring any excess HD to the surface to the risk. Carving and finishing, it should be done with scraping or ringing round surfaces to be here risk of. Final polishing should be delayed at least 24 hours after the condensation. It increases smoothness, decrease the plaque retention and decrease the Mercury toxicity is observed through the skin, lungs, and GIT, most commonly by the lungs. The threshold limit of the mercury in the air is 0.05 per milligram of Hugh meter. This vapor level to which average worker can be safely exposed for 8 hours a day, 5 days per week. Increases in the exposure causes toxicity, which may associate with the signs and symptoms. Lowest level of total blood mercury at which the earliest non-specific symptoms. It is a Minamata disease came to existence after Minamata Bay incident in Japan in 1952. A local chemical plant disposed of methyl mercury waste into the nearby bay, contaminating shellfishes, causing toxic level of mercury in the fish eaten by the local population. Symptoms include convulsion, numbness in the mouth and limbs, constriction in visual field, difficulty in speaking. Safety measures: it should not spill and leak. Water spray and high volume evacuation should be used to clean. Glass and disposable flask. Amalgamators completely used. The advantage, which includes reasonably easy to insert, not overlay technique, maintains anatomic form well, has an adequate resistance and retention. Disadvantage: color does not matches, more brittle, subjected to corrosion, galvanic shock, show marginal breakdown, do not bond to sources of high toxicity. Thank you.